Hi, hello you guys. Hi guys. Hello. Ayan. Hi, hello. Hi guys. It is a Sunday morning. Not actually Sunday morning. Sunday afternoon here and Sunday evening there in the Philippines. Hi, hello sa inyo sa mga nanonood dyan. Have currently we have 7,000 viewers ng ating live stream. Wow, maka 7,000 naman. Ayan. So, ngayon guys, you've requested it and here it. Alam ko medyo nabitin tayo sa ating previous topic, which is the news and the sepsis. So we actually didn't finish the sepsis part, kaya meron tayo ngayong part 2. Ayan. So meron tayo ngayong part 2. And because you've enjoyed your time watching her, she is back. She is back on our live stream. At saka yung mga ka-army niya dyan sa BTS, sa mga nag-aabang dyan kay Miss Golda. Ayan. Andito na ngayon ang isa sa mga alagad ni Robin Padilla. Charot! Isa sa mga alagad ng BTS. Ayan. So ngayon guys, are you ready for her? Because she's been ready all her life. Wow, ganun talaga. She's been ready to discuss to you the second part of sepsis. Ayan guys. So ngayon guys, pwede bang comment down below kayo kung saan kayo nanonood, kung sa kwarto ba, sa bahay nyo ba, or nasa duty ba kayo at pumupuslit na nanonood ng ating live stream. Please comment down below. Ayan guys. So without further ado, let us all welcome the beauty and the brain. Ayan. The beauty and the brain. Miss Golda. Ayan. Hi, Miss Golda. Ayan.
Hello, guys.
O, diba, guys? Mag-comment kayo dyan para mabasa natin. Ayan.
Hi.
Andito na naman tayo kay
Nurse
John
Cia. Hello,
isa talaga
Marvin Messina and Miss Janice Villondo. Ayan, nakikita ko sila. So, I have my other stream. Ayan. Sige.
Ayan.
Hello, guys. We're back.
Kumusta ba, Miss Golda? Nakapag-rest lang tayo ng kailan ba? Isang araw lang ata ang rest.
Isang araw. Pero yesterday you had your, diba? Meron kayong session din with Nurse Jack. So,
yes.
Nakita ko yung nakita ko yung stream nyo. So anyway, thank you so much guys for supporting this series of reviews of live stream. Taka naman, may nag-hi doon sa likod.
Ayan. Hi dyan sa BTS natin.
Sorry naman, baka iniisip nila, ano ba to? Ayan, sorry. Ayan. Meron akong background display.
May pa-background ng BTS. Actually, Miss Golda, sabi nga nung kaibigan nung housemate ko, sabi niya, nanood ako ng live stream ni Miss Golda at saka ni Miss Gail. Tapos tinanong siya, anong natutunan mo? Ay, nalaman ko po na mahilig po sa BTS si Miss Golda. Sa dami ng sinabi mo. Sa dami ng sinabi mo, yun lang.
Guys,
yun ang natandaan niya.
Lumalabas yung mga namin, yung mga true colors namin. Pero anyway.
Pakunwari ka pa, Miss Golda, ha?
Yeah.
Pakunwari. Kunwari ka pang, beauty and brain, pero isa ka rin pala sa mga army ng BTS.
Yes naman. Okay.
Oo, ayan.
Yan, syempre kailangan, di ba? Meron tayong mga inspirations natin na mga ayan. So, I'm sure fellow armies will understand.
Ayan, of course.
Yeah, so.
Actually, dahil sa'yo, pinakinggan ko talaga yung Dynamite. Hindi yun ang Dynamite. Hindi yun ang Dynamite. Guys, hindi yun ang Dynamite. Pero pinakinggan ko yun. Gusto ko talaga yung Dynamite. Pero dahil ni-remind mo
Totoo.
ako regarding BTS, pinakinggan ko ulit siya. Ayan.
Alam mo kasi kung bakit ganito yan. Like,
okay, sige. Before tayo mag-discuss
oo.
ng sepsis, mag-explain ka ngayon, Miss Golda. Bakit nga ba kasi?
I will consider myself a baby army kasi na-discover, like, BTS has been, like, there since 2013. Pero, lately ko lang sila binigyan ng attention na sobra-sobra. But, back in high school, like, super K-pop OG, Shinhwa group, and basta yung mga J-pop, mga Utada Hikaru, when we were younger. Pero kasi lately, di ba, alam mo yun, parang nasa bahay lang tayo, ganyan. So, I actually tried to listen to one of their songs. Tapos parang, sabi ko, oh my God, bumalik yung parang high school days ko. Ganun ba yun? Nag-regress.
Biglang gano'n?
Ibig sabihin, parang, alam mo yun, parang, sa panahon natin ngayon, like, it's really important. O, di ba, biglang naging serious.
Ay, ganun agad.
merong rationalization, no? But because, sa panahon natin ngayon, di ba, like, it's really, it takes a lot of effort for us to find something na, alam mo yun, na magpapasaya sa atin, or like, magiging, that will keep us going. So, aside from like, our personal lives, our families, ganyan. So, at least meron tayong mga healthy outlets na, alam mo yun. So, it may be through music, through art, through books, or whatsoever. So, kaya ganun siya. But for me, I found it through music. So, di ba?
Naman, Miss
ayan.
So, palakpakan
of
natin yung pagrarastan ni Miss Golda. Biglang gano'n. Alam mo, nag-explain ka, yung itsura ko, sabi ko ng itsura. Hindi ko talaga, hindi ko syempre we have our differences.
Mag-viral ka kasi, ang daming army sa YouTube, ganyan. Mag-viral ka, marami ka maging followers.
Madaming arming nagpa-follow dito. Ayan. Uy, kaya mo naman, mag-hi ka naman dyan sa mga nanonood yan. Sabi ni Annie, 23, Gwapa kaayo, uy. Unsa naman? Sige. Gwapa kaayo daw.
Shout out tayo, guys. So, maraming salamat sa 19,000 na nanonood at the moment. Ayan. So, pasensya na po at pagpasensyahan nyo na po kami ni Gail. Kung ano-ano pinag-usapan naman. But later on, we'll get down to business. So, mag-hi muna tayo. Ayan. So, sige, we have Mr. Kelvin Card watching from Riyadh, KSA. O, diba? Hello sa inyo dyan. To Miss Ivy Archua from Cebu. Maayong gabi sa inyong tanan sa Cebu na pananaw-gid mo sa live. And then to Mr. Marvin Messina and to Mr. Harold John, to Anis 23. Ay, wow. Thank you kaayo, halaoy. Kasi ko, nailad ra ka sa among mga lighting.
Diba? Kaya nga, sabi ko sa Miss Golda, meron na naman tayong 18,000 na nabudol.
19,000 na at the moment.
19,000 nabudol yan. Nabudol natin yan. Ayan.
Open-minded. Oy, meron tayong VIP nanonood ngayon. Si Nurse Raymond. What's up, you guys? What's up, you guys?
Yan, mga idol natin. Yan, mga what's
Raymond,
up, you guys?
Hello. Ayan. What's up,
guys,
you guys?
By the way, guys, Nurse Raymond has been very active on his YouTube channel. If you want to follow him, to subscribe to his channel, ang dami niyang mga useful tips on how to make your life easier. Yun talaga yung term ko.
Oo naman. Panoorin niyo, meron siyang, he has a new vlog about parang salary comparison of nurses, so the salary scale of nurses. So kung gusto niyo malaman yung mga ganong klaseng tips and like everything that you need to know about getting your dependents, your family, your dependent spouses, and follow niyo si Nurse Raymond. He has a lot of mga useful tips, especially about being a nurse here in Ireland. Ayan, okay ba tayo?
Si Nurse Raymond, marami yung mga tips on how to para maka-make use tayo ng mga tawag nito, hindi ko ma-explain yung i-make use natin yung stay natin dito because
Exactly.
he's
Ayan.
very
Oo.
generous and contributing his knowledge with regards to like
Naks naman. Ayan. Shout out to
hindi
Nurse
lang
Raymond.
nursing kundi family vlogs kasi yung sa kanya family
Totoo.
nursing
Oo.
medyo
Ayan.
halo-halo siya pero of course yung platform ni Nurse Raymond is always pareho rin naman kami ng mga passion is to help you guys
To
on
give
your stay.
information to everybody.
Exactly.
Ayan. Di ba?
Ayan. So, ayun na nga.
Nice.
May 10, naku, nakapag 10 minutes na naman tayo.
Yes. So,
Chismisan.
ano ba? Ready na ba kayong lahat? Handa na ba kayong lahat?
Handa
So,
naman na
etong
naman ang mga utak
19,000,
natin.
oo, etong 19,000 nanonood sa atin ngayon. Hopefully, magkaroon pa rin
Hanggang
sila ng
matapos.
patience. Oo, hanggang sa matapos tayo. But, we will try to, because we're just going to talk about the last part of the sepsis screening pathway. So, by the way, guys, kailan ba yun? That was Friday, no? That was Friday. So, today is Sunday. So, last Friday, guys, we started with our review sessions with Gail on her YouTube channel. So, I will just continue the part where I talked about the National Early Warning Score System and then the sepsis screening pathway. So if you can remember, guys, for those of you who are watching right now and who have also seen the first part of the live stream, so I will be continuing the topic about the sepsis screening pathway. So nasa sepsis screening pathway na po tayo. Ayan.
So guys, yung mga hindi pala nakapanood, sorry na lang. Ganon. Sorry na lang kung hindi tayo makahabol. So, kailangan napanood nyo na yung first part bago nyo mas maiintindihan nyo kung ano yung dinidiscuss namin today. Ayan. So, ano
okay.
na ba?
So, anyway, if hindi nila, kumaga, medyo, ngayon lang, for those of you who are just joining now, I think, ilalagay ni Gail yung link sa, dun sa first part. So, at least, diba, they'll be able to see the first part, part 1, and then ito yung part 2. So, anyway, we will try to pick up where we left off, kasi, diba, para magkaroon siya ng
talaga to, Miss Golda.
continuation.
Ang dami talagang nag-PM sa akin. Sabi talaga, ma'am, kailan po yung yung part 2 ng
part 2,
sepsis?
ayan. So,
Talagang pinanood nila 2 hours and 52 minutes.
Thank you so much.
Nag-tiis sila sa itsura nating dalawa.
Thank you sa inyo. Kahit minsan wala na sa, walang sense yung sinasabi namin. But anyway, so we have 20,000 viewers right now. Di ba? Kung makabudol, 20,000.
20,000 yung
ayan, sige.
natin.
So, hi to Ana Garcia. Ayan. God bless and take care. Sino pa ba? Ayan. Sige. So, I think we're all ready. We're all warmed up. Warm up na ba tayo, guys? Baka gusto nyo pa ng konting warm up?
Naku, madami pa kami pwedeng pag-usapan. O ano na, mag-sepsis form na ulit tayo. O anong gusto nyo?
Oo nga. Ayan. So, anyway, guys, so I think we stopped the part 1 on the second section of the sepsis screening pathway dun sa adult. But now, so siguro para at least simulan natin siya dun sa section 1 na lang. Guys, we are already discussing about the sepsis form in the inpatient adult from the last time. So, dun na lang natin siya simulan para at least medyo maka-catch up sila dun sa pinag-usapan natin. But before that, can you just give me 10 seconds? Kukuha lang ako ng tubig kasi para
Ayan.
para tuloy-tuloy tayo. Sige,
no
wait lang ha.
No worries, Miss Golda. Ayan. So, sorry guys, ayan. Habang kumukuha ng tubig si Miss Golda para i-prepare yung lalamunan niya ngayong umagang ito, meron tayong i-greet. Ayan, may pag-greetings muna tayo. Kasi, from the previous videos, talagang naglista ako, guys. Nilista ko talaga yung mga pangalan nila. Guys, shout out sa mga nanonood ng live stream namin na late na. Kasi alam ko merong iba na nasa duty, yung iba hindi na makapanood right at this very moment. So, shout out naman dyan kay Miss Donna Bernabe. Nag-PM talaga siya sa akin. Sabi niya pa, Miss Gail, di po ako talaga makapanood ng live stream nyo kasi at work ako. Pero binabalikan ko po yung live stream nyo. Ayan, hi sa iyo, Donna Donna Bernabe, and also to our new subscribers. Hi, Leslie Corbadura, Dara Mendoza, and Leona May Santander. Ayan, bago sila nag-subscribe at nag-comment sila sa aking previous YouTube live stream. Kaya ayan, kung gusto nyong ma-mention ang names nyo, comment down below. Ayan,
Wow,
para
hello.
naman malaman natin kung
23,
sino talaga.
23,000 viewers. Ayan. To Summer
Ayan.
Miranda, hello. Hello sa inyo. Right.
Ayan.
Okay. Shall we get it on? Talagang grabe yung tubig na kinuha ko.
Tinubigan po talaga ni Golda. Tinubigan po. Kaya
Oo,
po,
para
hold
dire-diretsong
on tight,
discussion.
guys. Sinasabi ko sa inyo, pag si Golda ang nagturo, isulat nyo lahat.
Dire-diretsong
Please.
discussion tayo dito. Ayan.
Yan. Ayan. Sige,
Sige. Okay,
sige.
guys. So, let's start. Everyone is ready. Ayan.
I think everyone is ready. Yes.
Perfect. Okay, sige. Di ba? Nandito kasi, tinitingnan ko
Ayan.
din kasi yung mga comments dyan. Ayan.
Comment.
So let's start. I will start the screen share. Okay, sige.
Ayan. Sige, accept yung screen share natin. Guys, again, guys, this is sepsis form inpatient adult. Adult ito, guys. Walang children dito, only adult. This is just a follow-up on the topic sepsis and how to actually understand what is sepsis and how to do our sepsis, or how to fill out our sepsis form. Ayan na, guys. Can you see it on the screen? And
Okay, sige.
ayan.
Perfect.
Ayan na.
Ayan,
Okay na,
24,000 na po yung ano. Okay
ayan,
na.
24,000 na po yung
24,000
nabudol
na.
natin.
Ayan, sige. Okay, guys. So, as you can see, this is the sepsis form in the inpatient adult. So, di ba, nung last Friday pa natin to tinitingnan. So, and for those who are also doing their reviews at home, wherever you are, in the Philippines, in the Middle East, or even here in Ireland, so I'm sure sawang-sawa na siguro kayo, hindi naman, joke. so siguro parang mabubutas na siguro yung screen nyo or yung papel na yung printout sa kakatingin nito. Ano ba to? What is this sepsis form, guys? Ano ba to? Okay, guys. So, diba, if you have seen the part 1 of our live stream, we talked about the National Early Warning Score System and how we were plotting the vital signs and how we took the total score of a patient and then how we're going to escalate the patient's condition. So, dahil, di ba, kung natatandaan nyo, if it is already a score of what? Anong score dapat? Kapag score na siya ng 4 and above, di ba? Ako din yung sumagot ng question ko. So, kapag
Sumagot
score,
kayo, guys.
kapag score na siya ng 4 and above or 5 on supplementing oxygen, we are already going to consider using the sepsis screening pathway for the adult patient. So I'm sure, sige lang, I'm sure alam naman nila yung pinag-uusapan natin, di ba? So we will now proceed with using the sepsis form assessment in the inpatient adult. Okay, guys. So on this first page, it says their sepsis form. So sabi dito, start sepsis if there is a suspicion of infection and the new score is above or equal to 4 or 5 on supplemental oxygen, or if you're exercising clinical judgment. So guys, if you can remember, di ba, may maliit na note dun sa escalation protocol chart natin na you may escalate at any time regardless of the score as long as you're exercising your clinical judgment. So, syempre guys, ito yung pinaka-importante. If you are exercising clinical judgment. Kasi naman, baka naman escalate tayo ng escalate and then hindi naman pala siya situation na dapat i-escalate. So, still, yun na nga, oo. So, we still need to use our clinical judgment and our common sense. So, okay guys. So, diniscuss natin to. So, section 1. So, in section 1, this is what you call the sepsis screening for the nursing staff. So, basically, these are just tick boxes that we need to answer at dapat it all applies to our patient. So section 1 says, If there is a suspicion of infection, so kailangan mo siyang i-tick. So ano ba yung suspicion of infection? Di ba kung matatandaan natin, meron tayong na-mention the previous time na SIRS criteria or Systemic Inflammatory Response criteria. Tama ba? At dapat matik natin ang 2 or more of these criterias. So I'm sure natatandaan nyo pa yon kung ano yung sinasabi ko na SIRS criteria. So anyway, in section 1, we have to establish that the patient is suspected for the presence of infection. So if you are sure that the patient has been suspected for the presence of infection, you have to tick this box kung meron nakasulat na suspicion of infection. And the second thing that you need to establish is to know what is your patient's presentation. So it's either 1, 2, or 3. So maraming nagtatanong, ano po ba tong patient presentation? So it says there, see section 3 in the adult inpatient sepsis algorithm. So ngayon, pupunta tayo, ano bang ibig sabihin ng patient presentation 1, 2, or 3? I think I have discussed this in the part 1, pero uulitin lang natin ng mabilisan para at least dun sa mga kaka-join lang sa live stream natin. Okay, so in section 3, you will see the different categories of the patient presentation. So they are divided into 3 categories. So ang ibig sabihin lang nito, kung ano yung patient presentation. So sino ba yung mga klase ng mga pasyente na dadating with a suspicion of infection? So patient presentation number 1, it says there, these are the patients at risk of neutropenia due to bone marrow failure, autoimmune disorders, or treatment, including but not limited to chemotherapy and radiotherapy who present unwell. So basically, guys, patient presentation number 1 are those patients with the risk of having neutropenic sepsis. Kasi they are undergoing chemotherapy, radiotherapy, or immunotherapy. So sila yung mga merong autoimmune disorders, merong cancer, and they present in the emergency department or in the hospital with the SIRS criteria and they are unwell. So sila po ang category 1. Category 2 patients are clinically apparent new onset organ failure or any of the following. So etong patient presentation number 2 are those patients with kung pwede natin siyang i-highlight or in-circle, ang sabi dyan, new onset of organ failure. Or basically, kung sino yung mga bagong presentation lang na naging unwell sila. So, kung makikita nyo yung mga tick boxes on their patient presentation 2, ito po yung sinasabi natin na mga SIRS criteria or systemic inflammatory response. So, they might have acutely altered mental state, oligo or anuria, non-blanching rash to skin, respiration rate of above 30, pallor or mottling with prolonged capillary refill, O2 saturation of less than 90%, heart rate of above 130, and systolic blood pressure of less than 100. So basically guys, ito yung mga SIRS criteria na present na bagong-bago for these patients under presentation number 2. Sa presentation number 3 naman are your patients with a systemic inflammatory response. So kanina pa natin minimension si SIRS, plus 1 comorbidity. So ano ba tong comorbidity? So alam natin yung term na comorbidity. Bilang nurses, we know that a comorbidity means an underlying condition of the patient. So this could be an underlying organ failure such as your COPD. So sometimes your patients might have a history of on and off chronic lung problems. So, yung mga smokers natin, we know that they are going to develop COPD in the long run. They could have problems with their blood sugar. So, yung mga merong diabetes mellitus, HIV or AIDS, chronic liver disease, cancer, chronic kidney disease, those who are on immunosuppressant medications such as steroids, those who are age 75 years and above, and those who are very frail, and those who have had recent surgery or major trauma. So basically, guys, the patient presentation number 3 are those patients presenting to the hospital unwell but with a comorbidity. So, naiintindihan ba natin yung pagkakaiba-ibahan ng patient presentation 1, 2, and 3? So, ngayon, meron akong tanong. Ma'am, bakit po yung patient presentation number 1, they are considered to be maybe cancer patients. Hindi po ba sila considered as patient presentation 3 dahil meron silang comorbidity? So, ang in-emphasize sa patient presentation number 1 are those who are undergoing active treatment. So, si patient presentation number 1 are those patients na kumbaga, kung meron silang cancer or meron silang autoimmune disorder, they are on active treatment at present. So, kaya sila merong risk of neutropenia. Yun namang patient presentation number 3, meron silang history of cancer or any such disease or comorbidity. So, okay ba tayo doon? Clear ba tayo, guys? Okay,
Please
so I
press
will
1
assume,
kung naintindihan.
yes, I will assume na clear naman. So, okay ba tayo? Babalik tayo ngayon kay section 1. So, ngayon, na-establish na natin na ang ating pasyente ay merong suspicion of infection. So, we will tick that box. And then, we will tick the box either 1, 2, or 3. Ano bang klaseng pasyente siya? Bagong diagnosis ba siya? Or bagong pasyente na nagpe-present sa emergency department with an underlying condition? Or isa ba siyang pasyente na already on active treatment pero naging unwell siya? So, okay ba, guys? So, here in section 1, don't ever forget to write the date, the time of the new score that you took. What is the new score? Your signature and your NMBI pin. So basically, guys, wala po tayong ibang new score na makikita dyan kung hindi 4 and above. Kasi yun yung requirement para pumasok tayo at gamitin natin yung sepsis screening form if the new score is equal or above 4. Okay ba? Ayan, no? May nakasulat siya dyan sa action. News should be above or equal to 4 or exercising clinical judgment, escalate to medical review within 30 minutes, and inform if screen positive, start the sepsis form, and put with clinical notes. So basically, guys, it's very common sense na kung ano man yung ginagawa natin dito sa sepsis form, i-document din natin siya. Okay ba, guys? Now, we will proceed.
Sorry.
Okay.
Sorry, may question lang. Nakita ko lang. Sabi ni Anis 23, sabi niya, Miss Golda, okay lang i-tick ang 1, 2, 3 kung applicable sa patient or isa lang pala?
So, in one patient, sure naman ako na isa lang yung matitik natin dyan. Kasi, kung ititik mo yung 1, 2, and 3, so for example, si patient, sige, gumawa tayo ng isang example ng pasyente, di ba? So, if...
mamamatay na ba ang pasyente natin dito?
Okay, so, sige, bigyan mo ako ng example ng pasyente. So, for example, there is a patient coming into the emergency department or in the ward, admitted, who is a 25-year-old male without any history of a medical problem, but he presented to the hospital with fever and cough and shortness of breath for the past 3 days. So, ano kayang patient presentation siya? 1, 2, or 3? Ano yung sabi ko? 25-year-old male patient without any history of a medical condition and then presenting to the hospital unwell, fever, cough, shortness of breath for 3 days. So what do you think is the patient's presentation?
Comment down below.
Ayan. So si Arlene de la Fuente, sabi niya, patient presentation 2. Of course, because it is,
Napakagaling.
ayan,
Talaga,
palakpakan.
napakagaling.
Kasi,
Arlene, naku
new
talaga.
onset of organ, so that, basically, it is a new patient. So, I don't think mangyayari na matitik mo siyang lahat because, first and foremost, isa lang talaga yung mapipili mo na patient presentation. Sige, another example before you move on. So, let's say, there is an 85-year-old patient coming into the emergency department who has had a recent fall and has had a hip replacement 2 weeks prior to admission. So, di ba kawawa naman si Lola? 85-year-old na post hip replacement.
Thank you, Miss Golda. Thank you po talaga. Kinawawa niyo po yung matanda.
2 weeks ago. At nag-present siya sa emergency department na unwell siya, si Lola. Okay, so si Marvin Messina, sabi niya, patient presentation 3. Tama ba? Kasi 85 years old, so alam naman natin, di ba? Geriatric yan, above 75 years old, and Lola has had a recent trauma and operation. So, patient presentation number 2 yun. Sige, another example. So,
Uy,
there is...
gustong-gusto ko tong group na to ngayon kasi
Oo
sumasagot
nga,
sila.
galing,
Apakagaling.
galing.
Talagang
Oo.
talino ng mga.
Very good. Ayan. And that's, diba, mas maganda yun, you make it as interactive as possible, diba?
Yes.
So, and then, one last example before we move on to the next section. Ayan. So, there is a 44-year-old female patient with a diagnosis of metastatic breast cancer and who is undergoing treatment with PO chemotherapy. She's on immunotherapy, but she presented to the institution with a neutrophil count of 0.00, and she has been
Thank you po
having...
sa 0.00. Thank you po. Nagsabi pa po kayo ng number.
And she has been unwell for the past few days. Okay, so
So,
diba,
ano ang
patient...
sagot?
So sabi ni Kelvin, ayan, at saka sabi ni Arlene, patient presentation 1. So, yan, ang galing. So guys, you can understand now the difference of the patient presentations, diba? So, hindi naman siya mangyayari na titik mo siya lahat because for sure, isa lang talaga yung patient presentation niya, kung saan siya nabebelong, di ba? So, that means that is part of your assessment kasi eto din yung gagawin niyo talaga to sa exam, di ba? So, you will be given in the RCSI practical test, you will be given a story. Ayan, merong situation. Tapos, yun yung i-apply nyo. You have to take what applies to the patient with the use of the sepsis inpatient adult form. So, di ba? O, ngayon pa lang, di ba? Practice. Ayan, galing. Practice na yun, di ba? So, alam nyo na kung paano mag-identify ng patient presentation. So, we can move on to the next section. So, now that we have established that the patient has a suspicion of infection, and we have established what kind of patient presentation the patient has, so we will proceed. The next step is that the sepsis diagnosis for the medical staff. Ayan. So, pupunta tayo kay section 2. So, it says there, document the site of the suspected infection after medical review. So, of course, guys, alam natin na kapag merong infection, meron talaga yung source. So, meron talagang punot dulo. Bakit naging unwell ang pasyente? Di ba? Ang lalim. Punot dulo. Kung bakit. Ayan. So, kung makikita natin dito, we have our different organ systems na could be the possible site of a possible infection. O, diba? So, alam naman natin na etong mga microorganisms all around us, lalo-lalo na ngayon, kilalang-kilala si COVID-19. So, alam naman natin kung anong klase ng microorganism or ano ba siya? Is it a bacteria? Is it a virus? Is it a fungi? Whatever. O, diba? Kung anong gusto yung pronunciation. So, anyway, basically, alam natin na itong mga to ay mga foreign bodies at mga hindi welcome sa katawan natin. That's why when there is an infection, alam naman natin na madi-disrupt ang normal function ng katawan natin. Now, so I think na-mention ko to nung part 1, pero bibilisan natin ng mabilis. So in your respiratory tract, meron tayong mga microorganisms that are responsible for forming an infection. So one of them is your Streptococcus pneumoniae and all your Mycobacterium tuberculosis. Ano pang pwedeng, yan, di ba? So, na-mention ko na to on the first part.
Memorize na naman,
Memorize
guys.
na lahat ng viewers
So,
natin.
alam niyo na,
Oo.
guys.
So, tsaka di ba minsan si COVID-19 pumapasok din siya sa lungs natin, so sa respiratory tract, which infects the respiratory tract, making us sick and unwell. Next is your skin. So, di ba, minsan meron tayong mga open wounds, yung mga post-operative wounds natin, they could become infected with a lot of microorganisms. But the most common ones are your Staphylococcus aureus na nasa normal flora ng skin mo. But sometimes, kapag sobrang baba ng immune system natin, it could cause some problems as well. And how about your central nervous system? So, ito yung mga microorganisms that cross the blood-brain barrier. Tama ba? And in turn, makes us unwell. So, sikat na sikat dito si mga meningeal viruses. Minsan mga viral yan sila na nag-i-infect sa central nervous system natin. Next is your intra-abdominal. Ibig sabihin, nasa loob ng tiyan natin.
Ayan.
Sorry?
Sorry, Miss Golda. Gusto ko lang i-emphasize, guys, itong sinasabi ni Miss Golda can also be, like, she's sharing this one. But also, guys, watch out for our RGM preparation with Emma. She will discuss in depth the infection control, the chain of infection, and hand hygiene. So,
so
guys,
abangan nyo rin yan, di ba?
Kaya kailangan yung i-catch up yung mga susunod na mga episode kasi konektado silang lahat. Guys.
Oo, ayan. Kasi para maintindihan nyo yung chain of infection, bakit nai-infect tayo, di ba, social? Pathophysiology, char. And then, in the intra-abdominal, di ba, ano yung pinakasikat na mga microorganisms that infect our intra-abdominal or our digestive system? So, di ba, nandyan, sikat na sikat si Heliobacter pylori or H. pylori. Ano pa? Yung mga, di ba, possible din yung mga ascaris, yung mga, ganyan, yung mga microorganisms that infect our digestive tract. And then, minsan din, pumapasok dyan si Clostridium difficile or C. diff, di ba? And then, ano pa? Okay, we'll move on to the next, catheter or device related. So, ano ba tong catheter or device related? So, minsan, meron tayong mga pasyente, lalo na yung mga nasa ICU, na mga naka-tracheostomy or naka-trachea, di ba? So, sometimes, they develop microorganisms or they develop infections from the insertion sites or lalo na yung mga patients natin na naka-suprapubic catheters or ano pa ba, yung mga post-ortho cases, di ba? Meron silang, para silang Robocop. Meron silang mga, tawag dito, mga metal sa katawan na mga alam mo yun, naka-cast ba sila, whatsoever. So, pwede siyang pagsimulan ng infection. And then, katulad ng, sige, magbigay tayo ng isang microorganism na posibleng mag-lodge dyan sa mga catheter or device related. So, minsan, tumutubo dyan sila MRSA, VRE, E. coli, minsan din si Pseudomonas, di ba? So, marami dyan. And then, in the urinary tract system, you have your common si E. coli or si Escherichia coli kasi nga sobrang lapit niya sa perianal area. So, 'di ba, minsan lalong-lalo na sa mga babae, that could be a very very common source of infection. So, yung mga prone sa UTI. And then in the intra-articular or bone, ano ang mga possible infections na that could infect your bone? So, 'di ba, minsan may mga posible ba yung mga osteoarthritis or yung mga, madaming possible na pwedeng mag-infect, makakause ng inflammation to your bones or, 'di ba? So, ayan. Okay ba? Clear ba? Meron tayong
Ay,
tanong. Wait
may
lang. May
tanong
tanong
sabi ni
dito.
VJ.
Hello,
Si Velia
VJ.
ito. Si
Yes?
Velia, sabi ni Velia, pwede po bang mag-abbreviate like PM or COPD or dapat sabihin mo talaga ng buo?
So, syempre naman, as much as... So, in the exam, you will be saying this na, alam mo, i-discuss mo kasi siya. You will be discussing this in front of an assessor. So, okay, accepted din naman yung mga abbreviations, but as much as
However,
possible, if you can, like, di ba? Well, if you know COPD or basta pag naiintindihan naman siya, as much as possible, you have to say what it is, di ba? So, hindi naman siguro siya. I think yung point niya na mag-abbreviate is more on in your medication management. So, as much as possible, hindi kayo pwedeng mag-use ng abbreviations for when you are talking about medications. But
and
in...
guys, ayun na nga. And guys, alam niyo yun, like, because this is nursing and because like, alam niyo na yun guys, I think, if I may suggest, like, kasi kung kasi sasabihin natin DM, like, alam mo yun, it would, I'd say, if you say diabetes mellitus, it would give an impact to your patient or to someone who's asking you, or say your clinical facilitator, or say your colleague, if he's asking you about like some diseases and you've said it like diabetes mellitus, it only reflects that you actually know what it is. Kasi nga guys, oh, alam naman natin, oh, like we know it within ourselves na I know what is a COPD, I know what is a DM, but however, it's the impact that you imply to what you're saying actually. But it
So,
still depends on you, like you know, when it pag ikaw na yung nandun, but then if we may suggest, para ano na lang,
as
para
much as
pareho kayo.
possible, just be concise. And if you can say the whole word, mas mabuti, di ba? Mas mabuti pa nga kung sabihin mong type 1 or type 2, o di ba? Char.
Tsaka
Because,
maganda kasi that you emphasize it kasi you know that you're on the same page. Alam mo 'yon? Kasi
okay
syempre
ba
may iba
guys?
naman na alam mo yun, may mga abbreviation naman na minsan hindi natin iba yung ibig sabihin natin pero iba din pala sa kanila, alam mo yun?
Exactly. So, if you can just be as clear and concise, for sure naman yung assessor nyo naman, if along the way, they will have questions, meron kang nasabi na medyo hindi nila naintindihan, they will actually really ask you. They will kindly, they will ask you in the middle kung may sinabi kayo, lalo na yung mga terminologies, kasi lalo na iba yung terminologies natin if we're coming from the Philippines, tapos iba yung mga terminologies nila dito. So for sure naman, it will all boil down to proper communication. So kung tayo, as much as possible, we will try to use the most general one na ginagamit natin. So,
And
okay
also
ba tayo,
guys,
guys?
remember, this is not just for exam, this is not just for adaptation. This is also like whenever you're on the floor, you're practicing. It is always ano na parang it is always hindi naman necessary pero maganda kasi yung feeling na like yung nurse ko, if I would be the patient, that yung nurse ko alam niya yung sinasabi niya. Alam niya yung ibig ko sabihin, rather than giving me abbreviation and then when I ask her, she might not know or she may know. Alam mo yung ganun.
Yeah.
So,
Okay ba,
ayun.
guys? So, we will move on to section 3. So, that is section 1, section 2, section 3. Natakal na natin siya. So, okay ba, guys? We will now proceed. So, of course, just a reminder, this section 2 is actually not your responsibility. This is the doctor's responsibility to document the site of the infection because sila naman yung nagda-diagnose. It's not you that will diagnose. You are just there to actually help the doctor assess what the patient has, diba? So, hindi ka naman ang doctor, hindi ka naman ang magda-diagnose. Now, there's also a box there in section 2 that says, no clinical suspicion of infection, terminate the form and sign at the bottom. So, there would be some cases wherein kahit pumasok na tayo sa sepsis screening pathway, kapag nag-decide ang doctor na, oh, actually, there is no clinical suspicion of infection, we will just have to just terminate this form and sign, document it as is. So minsan, it will be the doctor's prerogative or decision whether to move on to the next section or not. Kasi diba, yun na nga yung sinabi ko, sila naman yung nagda-diagnose. But for the most part, if people are really septic and they're really unwell, of course, you will proceed to the next sections, to the next level. So, okay ba guys? So first, section 1, 2, and 3, in a nutshell, is you are categorizing the patient, that the patient has a suspicion of infection, what the patient presentation is, either 1, 2, or 3, and where is the possible site of the suspected infection. Now, we will proceed to section 4. Ayan. So, ano siya? Tick boxes. So, sabi dito, if yes, after medical review to section 2, ayan, so diba, after na na-review ng nurse at ng doctor ang pasyente at pasok siya sa banga sa lahat ng tick boxes natin, suspicion of infection, na-identify nyo kung either 1, 2, or 3 siya, at na-identify ng doctor saan ang possible source or site of the infection, pupunta tayo kay section 4, which is already the start of your sepsis 6. So, eto, nakasulat sa section 4 ang time 0. So guys, ano ba tong time 0? Para naman tong military time na mayroong time 0, time 0. So basically guys, section 4 only says that if yes, after all the medical review, you have to start sepsis 6 and you have to put in time 0 because time 0 is basically just the start of your sepsis 6. Diba natutunan natin from the part 1 that sepsis 6 has to be done within 1 hour. Okay, guys? So, you have to remember that sepsis 6 has to be done within 1 hour. Kasi nga, di ba, we have established from the part 1 discussion that sepsis is a potentially life-threatening condition which results as the body's response to the presence of infection. So, it is something that we need to manage as quickly as we can. So, kaya may time 0 tayo. Okay ba, guys? Now, time 0, ano nga yung time 0? Time 0 is just the time that you start to use your sepsis 6. Ngayon, ano ba tong section 5? Bago tayo mag-proceed. Sabi naman dito sa section 5, if no, so after section 1, 2, and 3, kunyari, if there is no to infection with a high risk presentation of 1, 2, or 3, take no and sign off. If infection and low risk presentation, take infection and continue the usual treatment pathway. Review the diagnosis if the patient deteriorates. So, minsan, yun na yung sinasabi ko, it will be the doctor's discretion whether to just maybe sabihin ng doctor, actually, this patient has already been having this problem for the past few months whatsoever. He's known to us. We know this patient. He's just having this infection, blah, blah, blah. I'll just give him antibiotic. So, minsan, ganun po. Ito yung section 5. So, that's just the case if the doctor will decide na, okay, low risk presentation naman ng patient, so we will just give antibiotics. So, if this happens, still, what is the important thing to do? It has to be documented and still review the diagnosis if the patient deteriorates. So, this is just for section 5 if hindi siya pasok sa banga from section 1, 2, and 3. Okay ba, guys? But for the purposes of the exam, we will proceed because ito naman talaga ang ipoproceed natin. Now, so, di ba, babalik tayo kay section 4. Sabi ni section 4, if yes to all the medical reviews from section 1, 2, and 3, we will proceed. We will start our sepsis 6 and we will put our time 0. Now, before we really proceed to our sepsis 6, there is a box there underneath that says, has a decision been made to apply a relevant treatment limitation plan? Ano ba tong relevant treatment limitation plan, guys? So, in all our patients in the hospital, meron tayong parating ini-establish na patient's decision from the beginning of admission, meron tayong parating information na kailangang i-establish from the beginning of the patient's admission. And ano yun? Anybody that can put it in the comment section na nakakaisip ko, ano yung
Down
dapat natin?
below.
Ayan. Sige, para magising tayong lahat. So, what do you think is the meaning of this relevant treatment limitation? Ano yung pumapasok sa isip natin na every time meron tayong bagong pasyente, ina-establish natin, ano ba siya? Ganito ba siya? Or ano ba siya? Can anybody make, hindi siya wild guess, but it should be, ayan. It is
And
actually...
Also, reminder ko lang guys, this RGN preparation that we're doing is not just for the exam, okay? Hindi lang to sa exam, hindi lang ito sa RCSI, hindi lang
Ano to,
sa
parang enrichment nating lahat. Ayan.
This
parang
is
refresher.
This is for the practice. So guys, and we would want this RGN preparation episodes to be safe, and we don't want to be having issues with other how do I say this one? Other how do I say this one?
I think ang ibig sabihin ni Gail is that we are just doing this for the purposes of discussion because
And
I know we're all and education, we're all nurses and we're all basing this on the experiences that we have. So wala naman tayong we're not harming any patient. We're like, we're not using a patient.
The main purpose of this one
exactly
is just to educate you. So
yes.
if you have any
So
if you
guys,
have questions regarding the experience that we have during the exam, or we will not be able to discuss that one because this is a public platform, if you know what I mean. So if you have other questions regarding the form, we will be able to discuss that one. But if you have other questions that's not related to the form or to the form and what we're discussing, and we might not be able to entertain those questions. Is that all right?
So anyway, sige, balik tayo sa question ko.
Yan.
So meron dito sa box.
Arlene, may mga may mga sagot dito, sabi ni
Okay,
Arlene.
sige, let's go over their answers. Sige. So, has a decision been made to apply a relevant treatment limitation plan? So, kapag narinig niyo yung relevant treatment limitation plan, ito ay sige. So, sabi ni Arlene de la Fuente, could it be the discharge plan? So, malapit siya sa discharge plan na we established this from the very, very beginning ng pagdating ng pasyente natin. Ano yung status ng pasyente na to? So, di ba? Malapit-lapit siya sa discharge plan. It could be somewhat similar to that. So, sabi naman ni Anis, 23 is the consent. Aba, of course, importante na mayroong consent ang pasyente. So, ano ba tong consent na to? Ano yung sinasabi ng consent na ito? And then, sabi naman ni Marvin, governing bodies. So, ano ibig sabihin ng governing bodies? Anong medyo kailangan siguro i-expound yan, Marvin? And then, so for Kevin, treatment, risk stratification. And actually, guys, you are already describing kung ano, yung gusto kong, siya, 2 words. Clue.
2 words. Ding, ding, ding. English. Ganon.
2 words. English.
Sabi ni Roseanne, initial assessment.
Yes, kasi dinidescribe niyo na siya kung ano yung gusto kong 2 words na para mapasok siya sa banga. Ano ba tong ibig sabihin nitong, ayan. Sige, ano ba tayo? Halugugin natin ang ating mga brains.
Sige pa. Ano pang meron dyan? Baka may masagot.
Dinidescribe na nila, Gail. I think you already know what it is. So, ayan. Sige, ano pa? Napaka-importanting malaman natin kung ano ang status ng pasyente na to.
Miss Golda, pag tumama ba, anong premyo? May pa-premyo ka ba daw, Miss Golda?
Dapat may pa-premyo ka, Gail, ha? Dapat meron kang giveaway.
Ako ba ang may pa-premyo? Wala naman, biglang kayo, wala akong kinikita dito, Miss Golda.
Oo, pag tumama kayo, lilibre ko kayo ng kape.
Pagdating dito, sige, libre ka
may pa-coffee ako. Magko-coffee date tayo.
May libreng kape. Singilin nyo, singilin nyo. Sige, ano nang
Oo
sagot?
naman. 10 euro. 10
Ang
euro
demanding ni Kelvin? O kaya mamigay ng 10 euro?
sige, basta magko-coffee date tayo pagdating niya dito.
Ayan,
Malapit
sabi
na
ni
talaga. As in, describe nila.
Nursing management.
Napaka-importante. So, alam mo yung, di ba, Doc, eto na, emergency na. Ganyan, di ba, Gail? Emergency na. Tapos, ano ba to? Doc, ano ba to pa siya?
Siyempre yun.
Nurse, ano ba siya? Hint daw, hint. Paano ba?
Sabi ni
So, di ba, kunyari,
hint.
kunyari, di ba, emergency na, ayan na, parang nag-unwell yung pasyente, ganyan. Tapos, Doc, isa-start ko na ba yung line, ganto ganyan, or whatsoever. Minamanage yun yung pasyente, pero merong isang importante na kailangan talagang i-check mo as a nurse. Kailangan i-check mo kung ano ba siya. Natatawa na si Gail. Nauubusan ako ng hint kasi ayokong ibigay.
Baka gusto mo na lang sabihin, Miss Golda. Baka
escalation. Nandun na talaga. Dinidescribe nyo na siya. Malapit na. Kasi kapag sinabi ko, baka sabihin nila, pero, allergy. Sige, ano pa? Ayan. Meron talaga, guys, na kailangan, paano ba? Kasama siya sa patient's right. Kasama
siya pag, yun na nga, kasama siya pag emergency. Kasama siya pag kunwari, Doc. Ano po, may nag-arrest po si ano.
Ayan, ako, ayan na. Malapit na, guys.
Belia, kukurutin kita. Patient identification.
Okay, ano ba? Sirit na ba? Wala na talagang guys.
Ayan.
So, eto. So, going back to section 4 at going to the next box, so sabi dito, if we will proceed now, before we proceed with doing our sepsis 6, merong importanteng question, has a decision been made to apply a relevant treatment limitation plan? Because if not, sabi daw doon, do not proceed with sepsis pathway and document the limitations in the clinical notes. Natatawa na talaga ako. Okay, so sasabihin ko na lang yung word. Sige, para So guys, before you proceed with anything at all, with treating or managing your patients, ano ang dapat nating malaman na status ng pasyente? Diba? Ito ang tinatawag natin na resuscitation status. Okay ba?
Yun na talaga, guys. Ilista nyo, Pag hindi nyo talaga to sinulat, kayo.
Diba, guys? Does it make sense? So, sabi dito, has a decision been made? So, hindi naman siya code or no code, but it has to be the resuscitation status of your patient. Kaya diba sinasabi ko kanina pa lang na pagpasok pa lang ng pasyente, or pag-assess pa lang ng pasyente mo, like when you say, ganito kasi when you say resuscitation status, ang unang-unang pumapasok sa isip natin, hala, CPR, ganyan, code, ganyan, emergency, whatsoever. But actually, no. When our patients come into the hospital, it's supposed to be part of our assessment, diba? I'm sure, minsan na-overlook natin siya na assessment ng pasyente natin, but actually, this is an important one. Di ba tama ba, Gail? So, lalo na kapag dito sa Ireland, talagang from the very beginning, they would establish that, lalo na dun sa mga sick na mga pasyente, or lalo na dun sa mga elderly, because we have to know from the very beginning, meron bang treatment limitation plan ng pasyente natin? Kasi baka mamaya escalate tayo ng escalate, tapos meron palang naka-document na treatment limitation plan ang pasyente.
Alam ko hindi pa ito na-cover ng RGN preparation. But remember, guys, under the Code of Professional Conduct and Ethics, principle number 1, respect for dignity of the person. So,
yes.
Nagpo-fall yun doon, guys. So, ayan. Marami pang i-discuss doon.
Okay ba tayo? So,
pero all.
yan. So, kasi, So one example, sige, ganito na lang, that we can relate in our clinical area. So of course, there would be patients na sasabihin nating for full resuscitation, lalo na sino ba 'tong mga pasyente na usually ginagawang full resuscitation talaga ng mga doctors or like, as per discussion of the family and wherever. So usually, di ba, minsan may mga pasyente tayo na mga young people who have good prognosis with whatever diagnosis they have. So ito yung minsan talagang kung sa Filipino term pa is, "Doc, gawin niyo po ang lahat," di ba? Ganun 'yon. But
Ibigay niyo
sometimes,
po ang full epi, gano'n.
yon, ganyan. Minsan naman, meron tayong mga pasyente din sa hospital na maybe not for full resuscitation, so DNR or do not resuscitate, but sometimes the doctors will chart, okay, not for resuscitation, but for full ward level management. Or minsan isusulat nila, not for resus, not for resuscitation, not for escalation, but for symptom management. So, may mga ganun po tayo. So, usually kasi hindi siya masyadong, hindi natin siya masyadong pinapractice talaga. I mean, we're practicing this in the Philippines. We have all this document, but
But we
it's
don't
not,
have hindi siya laging ba, kumbaga
it's not
every
as,
time may mga emergency, laging full resource, laging full
exactly. Parang
resource.
it's not as discussed or it's not as specified. Whereas here in Ireland, dahil ito naman ang everyone is striving to come here and to study about these things. So, dito po sa Ireland, i-emphasize natin, very, very important po ang resuscitation status ng pasyente from the
Feeling ko kasi, Miss Golda,
onset.
mga Pilipino, takot mamatay.
Sino namang 'di ba? I mean, 'di
Oo.
ba? I mean, it is very, parang siyang topic na parang siyang taboo, na parang we are all kinda hesitant to talk about it.
Especially when you come from like our country na very conservative and very
Oo.
religious. Yeah.
Oo. But aside from that, so mamaya mame-mention natin 'yan kasi dito sa Ireland meron po tayong tinatawag na palliative care nursing, which is dito ko lang din po siya na-discover at na-appreciate. So, mamaya pupunta tayo dyan. So, anyway, ito lang naman yun talaga yung dalawang 2 words na gusto kong
Ulitin
i-establish.
natin.
Ayan. So,
Gusto nyo bang ulitin yan, guys? Yung word na yon?
So, resuscitation status. You have to establish. Ayan. So, sabi kasi dito, before we really start our Sepsis 6, has a decision been made to apply a relevant treatment limitation plan? If there is, sabi dito, do not proceed with the sepsis pathway and document these limitations in the clinical notes. But if there is not, there's no limitation to giving care to the patient, hala, sige, proceed. Go ahead with the sepsis 6. So, tama ba? So, if our patient, so let's say our patient is for full resuscitation, we want full treatment, full management to the patient, we will then proceed. Okay ba tayo, guys? May tanong bago tayo mag-proceed. Sabi ni Nurse John Sia, paano pong malalaman yung resuscitation status ng pasyente? So, of course, we have to ask the patient. So, if the patient is compos mentis, is aware, kaya yun ang importante, from admission time pa lang, sometimes it is already established. So, part yan ng discussion between the medical team, the doctors, the patient, minsan pa nga the family. So, very, kasi sila dito, they're very straightforward. They would really say na, okay, we want everything done. At saka, yung discussion naman ng resuscitation status ng pasyente, that also happens. There is also a discussion between the patient and the doctor and the family, and minsan involved pa nga dito yung palliative care nurses and the medical social worker. So, there is an interplay of the discussion kapag tsaka, malaking road yan, malaking isang discussion na naman yan, Gail. So maybe next time we can talk about palliative care nursing din naman in some of the discussions. But so basically, you will know if a patient
as we've mentioned, as Miss Golda have mentioned, meron siyang mini-mention na mga part ng team na hindi siya doktor, hindi siya nurse. Merong mga social worker, may other part of the MDT, which is the multidisciplinary team, na involved sa care ng patient. So watch out kayo guys because we have an episode for
Yes.
multidisciplinary team on Thursday.
Oo.
Ayan.
So, okay ba tayo, guys? Basta, ang tanong lang dyan, paano kung malalaman? Malalaman nyo talaga yan because that is documented
Malalaman nyo,
on your
sasabihin
patient.
po sa inyo,
Yes.
hindi po secret
Oo.
yon.
Oo. Because that will be properly documented in your patient's chart or in your documentation sa hospital. Okay, so guys, we will proceed. So, malapit na po tayong matapos. Ayan. Pero ito na yung pinaka-gist. Papasok na tayo sa pinaka-importanting part ng sepsis screening pathway, which is our sepsis 6. O, di ba? Ayan na. So, sabi pa rin dito, always use your clinical judgment. So, what is the sepsis 6? Ayan, sige. Iyan na natin dito. Tama ba? Nakikita naman siya ng lahat. So, what is sepsis 6? So, ito na tayo. Pumapasok na tayo sa sepsis 6. And the aim is to complete the sepsis 6 within 1 hour. So, take 3 and give 3. Kung matatandaan nyo sa part 1, pinag-usapan natin itong take 3 and give 3 ng mabilisan. Pero dito sa form na to, it is very much identified and dinescribe talaga siya kung ano ba itong take 3 and give 3. So, of course, first that you are going to do is to take 3. So, kukuha muna tayo using the sepsis 6. So, what are these things that we need to take? So, first, you have to take blood cultures. So, ayan, di ba? Meron sa first box dito. Take the blood cultures prior to giving antimicrobials unless this leads to a delay of more than 45 minutes. Other cultures as indicated by history and examination. So, guys, minention natin sa part 1 na it is important as part of our diagnostic procedure, as part of really pinning down where the source of infection is, we have to take the appropriate cultures. So, ano yung mga samples na pwede nating kunin where we can take culture. So, aside from blood culture, so syempre kumukuha tayo ng blood sample sa pasyente, we can also take the urine sample, the stool sample, the sputum sample, and what else? Ano pang pwedeng i-culture natin na mga sample sa pasyente? We can also take swabs, wound swabs, skin swabs, etong mga to. Because we are trying to identify the source of the infection and what is the microorganism causing this infection. We have to take the appropriate culture in order for us to give the proper antimicrobial. Tama ba? So, question po, na-mention dito, you have to give antimicrobial unless this leads to a delay of 45 minutes. So, minsan po, bago pa pumasok, bago pa malaman kung ano yung resulta ng mga culture results, minsan ang mga doctors, or not really minsan, but most of the time, they would always cover the patient and start the patient on an antimicrobial. So usually, they start the patient on a broad spectrum antibiotic, di ba? Okay, so mamaya i-explain natin yan. Another thing that you have to take from the patient is your blood test. So, kasama na po ang blood culture at ang blood test. So, ano ba itong blood test? Of course, guys, di ba, na-mention ko to, FBC, full blood count. Hindi po siya Foley bag catheter, ha? It is FBC, full blood count. Point of care lactate, napaka-importante. Diniscuss natin yan sa previous part natin, yung lactate. Ano ba itong lactate na to? Ibibigay ko ulit yung meaning ng lactate in a few. Aside from the FBC, we have to take our UNE. Ano po ba itong UNE? UNE means urea and electrolytes. LFTs, or what you call your liver function tests. Your COAG, which is your coagulation tests, such as your INR, your PT and APTT, and other investigations as indicated. So, dito din papasok yung pagkuha natin ng mga CRP level, ano pa ba, mga so yung renal profile is your UNE, LFT, minsan kumukuha pa tayo ng bone profile ng pasyente. So, all these blood tests that are important for us to see the bigger picture of what's happening to our patient. So, babalik ako kay point of care lactate. si point of care lactate ay napaka-importante, either venous or arterial. So, di ba, dito papasok yung mga ABG, VBG, yung mga blood gases natin. Bakit kaya nilagay si lactate as important? Because, first and foremost, lactate is a biomarker to determine whether there is a presence of infection in the blood. So, alam naman natin na ang lactate is formed after anaerobic metabolism. So, if there is a presence of lactate in the blood, if there's a high presence of lactate in the blood, that means that there is poor oxygen perfusion to your other body systems. Kasi naka-cloud siya ng lactate mo, ng lactate. So that means there is no proper oxygen distribution and perfusion to other parts of the body systems. So kapag naman elevated ang lactate level, ibig sabihin yan, meron talagang presence of infection or inflammation and somewhere in the body. Next is to take the urine output. Bakit importanteng i-assess ang urine output as part of, kanina ko pa sinasabi, volume and perfusion status of your patient. So of course, we have to assess ang pag-assess natin sa pasyente natin ay per body system. So, alam naman natin ang kidneys natin ay importante. Ang kidneys natin that are acting as filters for our body, di ba? At alam natin na kapag merong poor urine output or ano yung urine output, it says a lot of things about what our patient is undergoing. Malalaman natin through the urine output kung ang pasyente ba natin ay dehydrated. Malalaman din natin kung ang pasyente natin ay fluid overload, di ba? Through the urine output of our patient. Now, the most important thing to know is what is the normal urine output of the patient. So, makikita niyo yung normal urine output ng pasyente. Nandun siya sa new score chart natin kanina. But because of that, I will just say, so the normal urine output is 0.5 ml per kg per hour. So, 0.5 mils or milliliter per kilogram per hour. So, kung meron po tayong pasyente na, let's say, weighing 75 kilograms, ano po ang normal urine output ng pasyente na yan per hour? So, that is just 75 times 0.5. Tama ba? Okay. Buhay pa naman ang lahat. So,
Kaya pa.
Kaya pa?
Nakatipig lang. Ano ba yung sinasabi ni Miss Golda?
Okay. So, sige, i-calculate natin ngayon. So, kapag meron tayong pasyente na, let's say, 75 kilograms, weighing 75 kilograms, times 0.5. So, that means, ang normal urine output ng pasyente na yon is 37.5 mils or milliliters ml per hour. Tama ba? Okay ba tayo, guys? So, 0.5 mils per kg per hour. Now, tapos na tayo sa take 3. So, take 3, you have to take blood culture, take blood test, and check the urine output of the patient. After taking 3, we will give 3. So, syempre, take and give siya. So, kumuha ka, pero ibabalik mo. In the form of, first that you're going to give is to give patient oxygen. Because, alam naman natin na sa patients who are undergoing SEERS, di ba? Na-mention natin sa SEERS kanina, minsan nagdi-desaturate sila. So, our goal is to maintain an oxygen saturation between 94 to 98% or 88 to 92% for those with chronic lung disease or COPD or whatsoever and the like, or sino yung mga may asthma, chronic asthma, whatsoever. But basically, the gist is to give oxygen. Kasi di ba kanina na-mention ko yung lactate? When there is a high concentration of lactate in the blood, your oxygenation is very poor. Kapag poor ang oxygenation mo ngayon, natural, ang oxygen saturation mo ay bababa. Kaya po nagkakaroon tayo ng mga shortness of breath, desaturation, because wala ng proper perfusion sa body systems natin. Kaya we have to incorporate or give oxygen to our patients. So, depende na yan kung ano ang order ng doktor. Minsan, ang pinaka-common na binibigay is 2 liters per minute via nasal prongs for 2 to 4, or minsan din gumagamit tayo ng mga oxygen masks. So minsan nag-order ang doktor ng please give oxygen to the patient with 40% concentration at 10 liters using a Venturi mask. So, ibang topic din yan. So, magpapakita tayo kung anong mga itsura ng mga Venturi mask at ng mga nasal prongs na ginagamit natin sa Ireland. So, but basically, we have to give oxygen to maintain an oxygen saturation of a normal level. Second that you're going to give is you're going to give fluid. So, volume in the first hour, dapat magbigay po tayo ng 2,000 mils or 2 liters of fluids in 1 hour. Yan po ang goal. So, patients who present with hypotension should receive 30 mils per kg of a balanced salt solution within 1 hour of presentation. So, nakadepende pa rin siya sa weight ng pasyente nyo. At of course, nakadepende pa rin siya kung ano ang status ng pasyente. Because yung fluids po, napaka-importante. Hindi lahat ng pasyente bibigyan natin ng sobra-sobrang dami ng fluid. Because we have to also review the medical history of the patient. Minsan, sige, bigyan niya ng fluid kasi dehydrated. But sometimes we have to know some patients have the tendency to be overloaded very quickly, lalo na yung mga pasyente natin with the history of cardiac problems. Yes. Such as people presenting with the history of heart failure or kidney problems. So, minsan, maingat po tayong magbigay ng fluids dyan. But, at the end of the day, we have to give fluids to our patients. So, kaya nga sabi dito, patients with hypoperfusion should receive fluid to restore perfusion using a bolus and review technique. So, minsan, nabubolus ang doktor, tapos i-review ulit kung okay ba. So, paano natin nire-review ang perfusion ng pasyente? We check the blood pressure of the patient. Kasi yan yung isa sa mga manifestation kung proper ba yung perfusion ng pasyente natin. Now, sabi dito, 500 ml boluses are recommended but may be amended based on clinical context. So, ito yung sinasabi ko, based on clinical context, kung ano ba ang clinical context ng pasyente nyo, di ba? So, it will all depend on the doctor's order because hindi naman tayo yung nag-order ng fluid sa pasyente. So, we are just there to carry out the orders of the doctor. But, of course, we have to note na, doc, actually, this happens sometimes. So, sometimes doctors would order, okay, can you please give 500 mils of bolus to the patient stat? And then, minsan, syempre, tao lang din naman ang doctors natin. So, minsan, us nurses, kaya bakit sinasabi kong importante na hand in hand and we have open communication with our medical team. Minsan baka na-overlook ng doctor, actually this patient has a history of a cardiac problem. So maybe we might have to just limit the fluids that we're going to give. So, di ba, ganun siya. Or at least, hindi naman natin in-overload yung pasyente natin ng fluid. Or minsan, baka mamaya, actually, doctor, I think this is not enough. Or after giving the patient 500 mils of bolus, mababa pa rin yung blood pressure niya. So, sometimes the doctors would start them on pressors. So, mamaya pupunta tayo dyan. So, basically, magbibigay tayo ng oxygen, ng fluid. And third most important thing that we're going to give to our patient is to give antimicrobials. So, ano ba itong antimicrobials? So, alam natin na ang antimicrobials, they mean the antibiotics, antifungal, antiviral medications because ito talaga yung magti-treat sa infection ng pasyente natin. So, I have mentioned earlier that sometimes doctors or the medical people will start our patients on antimicrobials even though there is no results yet from the cultures that we took. So, it is important for the doctors to start our patients on a broad spectrum antimicrobial. So alam naman natin
Okay.
yan. And the most important thing that we have to note before administering any medication to our patient, not just antimicrobials, but any medication, is we have to know the allergy status of the patient. Kasi importanteng malaman natin, baka mamaya mag-react yung pasyente natin. Instead of trying to do good to our patient, baka mamaya, pag allergic pala siya sa medication na binigay natin, mas magkaroon siya ng problema, mag-anaphylactic shock siya, di ba? So, it is still important. It all boils down to our patient assessment. Now, nakasulat dyan, what is the type of the antimicrobial, what is the dose, and what is the time given? So, common sense would tell us na syempre dapat documented yung mga bagay na yan. Now, sabi dito, give antimicrobials as per local antimicrobial guideline based on the site of infection. Kasi lahat ng antimicrobials or lahat ng medications, meron siyang indication, meron siyang kanya-kanyang indication kung para saan siya para saan siya, para anong
Kunwari
para
for like
anong exactly
infection siya sa
anong
urinary tract or sa
yes. So,
respiratory system or sa blood.
yan. So, dapat as per antimicrobial guideline siya. And yun na nga, yung allergy status ng pasyente. And assess requirement for source control. So, pagkatapos nyo pong mag-take 3 and mag-give 3, hindi po natatapos yung responsibility natin as nurses doon because we have to keep on assessing our patient every now and then. Diba? Diba yun na nga yung sabi nila, assess, reassess, manage, and reassess the patient along the way. So, diba kanina, sabi dito, we have to aim to complete the sepsis 6 within 1 hour. After 1 hour, we have to reassess the patient again and see if tama ba ang management na binigay natin or if nagkaroon ba ng bagong problema ang pasyente natin. In section 7, it says there, look for signs of new organ dysfunction after the sepsis 6 bundle has been given or from blood test results, anyone is sufficient. Now guys, eto na ngayon, we are on the process of assessing our patient. After giving the sepsis 6, we have to reassess the patient status. Now, sometimes, doctors might order for a repeat blood test, for a repeat lactate level, at dito natin malalaman ngayon kung nagkaroon ba ng changes, nagkaroon ba ng success yung pagbibigay natin ng sepsis 6 management to the patient. Now, if the lactate is more than or equal to 4 even after intravenous therapy of fluids, sabi dyan, kung hindi pa rin siya nag-normalize, problema yan. If your blood pressure is still below 90 or your mean arterial pressure is still below 65, despite giving all our fluids, our pressors, that means that is already a problem. If your patient needs a new requirement of oxygen to achieve more than 90%, meaning continuously patient is desaturating even though we are giving oxygen, isang problema din yan. If your renal status is becoming worse despite adequate fluid resuscitation, so dyan makikita nyo si creatinine. Creatinine is, ano bang ibig sabihin ng creatinine? So it is an important biomarker to note kidney function, tama ba? Because ang creatinine, dapat po, meron lang siyang normal levels kasi sinisikret po ng kidney natin ang creatinine, tama ba? Kapag merong mataas na creatinine, meaning hindi siya nafi-filter ng kidney natin. So, meaning may problema. If your bilirubin, so ano tong bilirubin? It is found in our liver. If it is more than 32 micromole per liter, so meaning kung elevated ang ating mga liver enzymes, meaning there is already a problem. And if your platelets keep on dropping, and if the patient becomes disorientated, confused, meaning meron po tayong bagong organ dysfunction. Now, sabi dito sa section 7, anyone is sufficient. Kung kanina sa Sears criteria natin, kailangan nating humanap ng 2 or more, dito sa reassessment natin, if it only takes 1 one from these signs and symptoms in order for us to establish that the patient is having a new organ dysfunction due to infection. So sabi dito, if merong present na isa lang dyan, even after giving the sepsis 6, you have to take and see that this is sepsis and that you have to seek senior input as per local guideline. So guys, meaning yung pasyente mo, even after giving the sepsis 6 bundle, meron pa rin siyang signs and symptoms of any one of these that we mentioned. Your patient is very, very septic, is undergoing sepsis, and the next step is for you to look out for signs of septic shock. So that means, ito yung delikado because septic shock could be irreversible kung hindi siya ma-handle ng maayos. Now, pwede din naman siyang, if after sepsis 6, you reassess your patient and there is no sign of new organ dysfunction, then that means you can take this other box here. This is not sepsis. If infection is diagnosed, proceed with the usual treatment pathway for that infection. So that means gumana yung sepsis 6 natin at na-contain ang infection ng pasyente mo. So that means we will just continue with our usual treatment pathway. But if the patient is continuously becoming unwell, becoming septic, the next step is to go to section 8 and to look for signs of septic shock. So alam naman natin na ang pasyente, kaya nga di ba sinabi namin kanina na when someone is having sepsis, ang kalaban natin ay ang oras. So, dapat mabilis tayong mag-manage, mag-assess, mag-reassess ng pasyente, and we have to know who to tap, who to refer the patient to. Kasi, hindi naman, when we're managing the patient, it's not just the nurse's responsibility, it's not just the doctor's responsibility, but it is our joint responsibility. So that's why we're called the health professional team because it should be a proper management between doctors, nurses, and all the other multidisciplinary team involved in caring for the patient. So sabi dito sa section 8, look for signs of septic shock. Following adequate initial fluid resuscitation. So typically, most of the time, 2 liters in the first hour unless fluid intolerant. So kapag po nag-undergo ng septic shock ang pasyente natin, alam natin na ang blood pressure bumababa, ang oxygen saturation bumababa, and we are required to give inotropes or pressors just to maintain a patient's mean arterial pressure of above or equal to 65. So anong ibig sabihin ng inotropes and pressors? Ito po yung sinatawag natin na mga epinephrine, dopamine, dobutamine, all these pressors that will help the patient achieve a mean arterial pressure that is normal. So kapag po hindi pa rin niya kayang iakyat ang vital signs ng pasyente or ang condition ng pasyente, meaning this patient is undergoing septic shock. And what is the most important thing to do when a patient is undergoing septic shock? Hindi po tayo dapat pwede mag-panic, but we have to inform the consultant and contact critical care. So ito yung sinasabi ko na this is a multidisciplinary responsibility. So hindi mo naman kasalanan or hindi mo dapat akuin yung responsibility na sa'yo lang because this is a full multidisciplinary team responsibility. So, ano ibig sabihin lang nito? So, we have to inform the consultant kasi siya yung pinakamataas na level ng medical team and to contact the critical care. So, sometimes patients that are undergoing septic shock or who are entering this stage of sepsis, they are most of the time, most talaga, not all, maybe all, will be transferred to a higher level of care or critical care because ito na yung tinatawag natin ng mga pasyente na one-to-one care. Tama ba? Because, syempre, constant monitoring. Continuous patient monitoring. So, sabi dito, practical guidance. Reassess the patient's clinical response frequently. So, di ba, reassess and repeat the lactate if the first is abnormal by 3 hours. So, ang pinaka-importante is to achieve source control as soon as possible, as soon as practicable, because the more that we know the source of the infection and the more that we know what kind of infection it is, the more appropriate management, the more appropriate medication, and the more appropriate antimicrobial or antibiotic we can give to the patient to manage it, to treat it, di ba? So if the patient is deteriorating despite appropriate treatment, wag mag-alala because you can seek senior assistance, reassess the antimicrobial therapy, and the need for source control. So guys, maraming taong pwedeng itap. It's not just the nurses, it's not just yourself, but it is everybody around you, everybody that surrounds the care of the patient ang responsible for giving the proper management to the patient. And with that, that is our sepsis screening pathway. Now, pathway modification. Sabi dito, all pathway modifications need to be agreed by the hospital sepsis committee and be in line with the national clinical guideline. Ano ba itong pathway modification? So ito lang yung sinasabi ko kanina na sometimes in every step of the way, there could be a little change. Minsan hindi na follow yung protocol. But if there is a modification in every step of the way, everything has to be documented and has to follow the hospital's protocol or the hospital's guideline. Now, any questions so far with regards to what we have discussed? Okay ba?
May questions pa kayo, guys? This is your chance now. By the way, shout out ko lang Miss Golda, si Nurse Eva, sabi niya, hello Miss Gail and Miss Golda, great collab. God bless you both. Thanks.
Hello,
Nurse
thank you so much Nurse Eva. Hello, how are you? Hope
si Nurse Eva meron din siyang YouTube channel niya. Nandito rin siya sa Ireland.
Hello Nurse Eva. Thank you so much for joining us this afternoon. Ayan guys, so any questions with regards to our sepsis screening pathway? So basically guys, baka may makita kayo sa section 9, kasama pa rin tong section 9. Although this is not my topic to discuss, pero pahapyaw kung sino man magdi-discuss nito, Gail. So in the clinical handover, we use the ISBAR communication tool. So mamaya, baka later on in the series of reviews, somebody will talk about ISBAR. And ISBAR is an acronym that we use to do proper communication and proper handover to our doctor. So ISBAR stands for Identification, Situation, Background, Assessment, and Recommendation. So mamaya, malalaman nyo yan paano gamitin ng ISBAR. Basically, it is just a communication tool of how you're going to refer your patient to the medical team. Meron siyang format. So, ano lang yan?
Another one, guys, gusto ko lang i-emphasize, guys. Yung sinasabi ni Miss Golda na handover. Kasi yung term namin dito, natin, in the future, pagdating niya dito, it's the term is handover. Hindi siya endorsement. Okay?
Hindi siya endorsement, ha? Handover siya. Clinical handover. Ayan. So, ayan guys. So, we have discussed the sepsis form in the inpatient
may tanong
adult.
Pa ba kayo bago...
Any questions?
Ayan, may tanong ba kayo? Sabi ni Marvin Messina, parang may galit. Sabi niya, loud and clear po.
Thank you so much, Marvin. So,
kanina pa si Marvin, nag-aabang talaga yan, si Mr. Marvin.
Nakinig talaga siya sa discussion natin. So, maraming salamat. 19,000. Shout out. 19,000 viewers.
Strong. Strong talaga. Ayan. Guys, don't forget to like this live stream, by the way. And hopefully, guys, ma-motivate ko na and ma-encourage ko na si Miss Golda na gumawa ng kanyang YouTube channel. Pero nung tinanong ko po siya, guys, kung ano po ang platform niya. Tayo nagkaka-problema, guys. Nag-expect ako na ang platform niya is the same as mine. Like, say, education or educating our future Irish nurses. Or, pwede bang discussion of Irish nursing here in Ireland. Pero guys, alam nyo ba kung ano ang sagot niya? Nung tinanong ko siya, ang sabi niya po sa akin ay, magdi-discuss po siya ng BTS. Ayan. So, alam niyo yun, guys. Motivated talaga siya ng BTS. Ayan.
Mga unboxing ng mga merch.
Mga unboxing, yun talaga pala ang plano niya, guys. Alam niyo
Hindi
yun?
naman. Ano pa din, kailangan connect natin siya sa nursing life natin, di ba? So, ganun
Pag
siya.
tinanong mo si Miss Golda ngayon, Miss Golda, ano po yung plano niyo ngayon? Baka sagutin niya, guys, gusto kong mag-mortgage para ano yun? Gusto mo mag-mortgage? Kasi,
Para
sagutin mo,
maglagay ng room para sa collection ng
sa
memorabilia
kanyang
niya.
merch. BTS merch, guys. Alam niyo yun. Gustong-gusto niya talaga yun.
Oo
Gusto
nga,
niya yung mga boys na sumasaya ng na, 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 na,
Oy,
na,
aside
na.
from that, hindi naman. Marami tayong mga other collections like, di ba, mga, alam mo. Pero anyway, guys, the gist, the summary. Oo. So, baka naman isipin nila sobrang addictos ako, no?
The gist.
Oo
The sub.
naman. The gist of this
Ay,
afternoon
hindi,
session
hindi pa
is,
ba, Miss Golda?
ay, ano pa, entering pa sa stage. Pero, pinipigilan ko pa yung sarili
Entering
ko.
pa. Oo.
Oo, ayan. So guys, any questions about the
May,
sepsis screening
may
pathway?
tanong ba kayo? Take this chance, guys, to
Sige.
ask regarding sepsis and sepsis form. Ayan. Kasi guys, wala nang tanong. Charot.
Stop ko muna yung
Pwede pa rin
screen
naman
share
kayong,
ko. Ayan, sige.
ayan, pwede pa rin naman kayong magtanong, guys, kahit na-stop na tong live stream natin. Kasi, andyan lang naman si Miss Golda, pwede nating pagtanungan. And, kung alam ko rin yung sagot, pwede ako makapag-reply agad. Pero, of course, andyan si Miss Golda para suportahan tayo sa ating mga paghihirap. Sa
Char.
ating,
Paghihirap
ano,
talaga. Hindi
paghihirap
naman.
talaga.
So, I
Anyways,
just
guys,
hope,
wala na ba kayong
lang.
questions? Or kung may gusto kayong sabihin, may gusto mo kayong sabihin nyo na ngayon nang magkaalaman na tayo. Ay, oy Marvin, anong comment na dyan? Sir, meron ba kayong mga topics that you want us to discuss? Kung meron ba kayong gustong sabihin kay Miss Golda, sabi ka, bago ang lahat, sabi niya pa, Miss Golda, parang, nawala tuloy yung comment na yun. Sabi niya, kamukha mo daw si Claudine Barreto eh.
Ay,
Ayan.
mas maganda pa si
Asan na yun?
Claudine.
Ayan, Miss Golda, sabi ni Ana Garcia.
Nalilinlang lang po kayo.
Kamukha niyo po Claudine Barreto. So siya, ang ganda mo doon, girl.
Wow,
Ayan.
grabe naman. Thank you naman.
So, guys,
thank you sa inyo. Thank you sa mga nabubudol po namin.
Meron pa kaming 17,000 na nabubudol at this very moment. Guys,
yes. So,
bago pala ang lahat, guys, gusto ko lang sabihin pala, guys, na meron tayong upcoming RGM preparation episode this week. I have hand hygiene. I have multidisciplinary team. We have ISBAR. And we also have, of course, Mayora. Mayora will speak about PPEs or our personal protective equipment.
Oh yes, follow nyo si Mayora,
follow nyo pala si Mayora.
Exclusively yan. She's like one of the OG, like original, ano talaga siya, YouTubers na nurse, Filipino nurse in Ireland. Kasi mas matagal, mas ano po siya sa amin. As in like, Senyora, Mayora.
Sabi ni Anis, sabihin mo nga sa amin kung anong pangalan mo, Anis. Anis 23 kami ng Anis 23. Sabi niya, thank you so much, Gigi. Wow, Gigi. May bago ng tandem. Guys, welcome to our series, Gigi. Ano po next topic ni Miss Golda? Ayan, Miss Golda, meron na tayong mga request. Sabi ni ni Anis na, ano pong next topic ni Miss Golda? Oy! Ano ka? In demand ka na.
Ay, teka lang. May sasagutin ako na question. Kasi sabi ni Eileen, sino daw yung bias ko sa BTS? Yun talaga yung sasagutin na question.
Ay, kilala. Naglagay ka nung last time. Kung sino yung bias. Oo. O, sino bang bias mo sa BTS?
Si Jungkook. Si JK.
Hindi, naglagay ka sa My Day mo, sa stories mo. Hello?
Ay, naglagay ako. Oo, nandun. Oo. Follow niyo ako sa Instagram.
Ako pa ba? Follower mo din ako.
Ayan nga. Instagram, Golda Stephanie.
Yan si Eileen. Si Quavo.
Balik na naman tayo. Wala tayo sa topic. Oo, hello.
Oo. Naku, basta na BTS
JK
talaga nawawala ako
bias.
sa topic, Miss
Jungkook.
Gold.
Oo.
Ayan. Si
Oo.
Anis pala, Janice po ang name
Janice
ko,
pala
sabi
siya.
niya. Janice pala ang
Oo.
name.
Oo.
So, we are looking forward still, Miss Golda, sa mga future
Same
topics
daw
na
kami
pwede
ng
natin pag-usapan. The GG tandem. Yan pala ang gusto niya.
Gigi. Oh,
GG
mga ganda yan,
tandem.
girl. Girl
Gulo-gulo buhay
tandem.
tandem.
Gulo-gulo buhay,
Girl.
ganyan.
Oo. Ayun.
Maganda
Pero yun
yan,
na nga,
oo.
as of the moment, wala pa kaming na-agree na pag-usapan ni Miss Golda as to what will be her topics on the future RGN preparation episodes.
Kailangan, magpapaturo
Guys,
pa ako kila Gail paano magawa ng YouTube
budol ko
channel.
muna siya. Ko ulit siya, guys. Meron tayo. Ano yan? Sabi mo, sorry?
Magpapaturo pa ako sa inyo
Ano
paano
sabi mo,
gumawa
Miss
ng
Golda?
YouTube channel. Magpapaturo pa ako sa inyo paano gumawa ng YouTube channel kasi hindi ako
Ah,
marunong.
ako, anak ko, nag-isip lang din ako paano ko ba sinimulan to? Ano lang din eh, trip-trip lang nung una hanggang sa naging seryoso na. Anyways, you
Oo nga.
guys, we will have our announcement with what will be Miss Golda's next topic. And hopefully, mabudol ko siya. At pag nabudol ko siya, malalaman niyo naman, guys, kasi ipopost ko sa ating Filipino Nurses in Ireland na group page at saka dun sa new NMBI
Yes.
application
Thank
for
you so much,
nurses.
guys. We
Thank you
really
so much
appreciate
again,
your
Miss Golda,
presence
for this.
and oo nga. So, sino ba yung next topic mo na sa series of your
The
discussion?
next one will be Emma Gamaya. She will be talking about hand hygiene and infection control or the chains of
Ayan.
infection.
Sige.
Yan.
Si Nurse Emma, okay guys, so you have to watch out for that because that is a very important topic. Hand hygiene and the chain of infection.
Chain of
So,
infection.
yan. Magandang discussion yan. Oh.
Because guys, eto konting tip lang guys, because wala tayong live streaming from Monday and Tuesday, I'd suggest that you would like to read about, ito yung sinabi ko kaninang may mga principles tayo. Yung NMBI Code of Professional Conduct and Ethics.
Okay.
You might want to read about it. It will discuss about, like, it has 5 principles. So, we will probably have another series or another episode for that one. Pero for the meantime, na wala tayong ginagawa sa bahay or say if you have free time,
sige,
you can go
ipakita
to
natin sa
NMBI
kanila
website.
yun.
Yes,
Ipakita natin sa kanila yun. Teka lang ha, para i-screen share ko sa tawag
sige.
dito. Ano yun?
It
Yung
is essential
NMBI,
professional
di ba?
code and Guys, kaya ko siya in-emphasize, guys, kasi this will be yung guide nyo to becoming a nurse here in Ireland.
Ang dami palang na-add, no? Kasi I think, guys, they are also putting, alam mo yun. Teka lang, hinahanap ko yung girl.
Hey guys, you can always send us a direct message just in case meron kayong question that the things that we can't discuss publicly, if you know what I mean. So yun na guys, sabi nga pala ni sabi ni Marvin Messina, pa-request po uli kay Ma'am Golda sa susunod na topics para mas magana po sa review. Oy Marvin, ano yan? Ikaw ha? Marvin
Teka lang,
ha?
i-screen share ko to, girl, para makita nila. Wait lang ha. Para makita nila to.
Sige. Shout out nga pala sa nanay ko. Wow, nanonood yung nanay ko from the Philippines.
Wow.
Ayan.
So guys, ito pala yun.
Kelvin,
Pwede nyo basahin to.
ayan,
Code
sige,
of
open ko
Professional.
ngayon. Wait.
Ayan, sige. Pakita mo
Ayan.
sa kanila para,
Ayan siya, guys.
ito yung itsura
Ayan,
nun.
ito siya, ha?
Ito siya, guys.
Yan yung
So it's
sinasabi
like a
kong Code of
book.
Professional Conduct and Ethics.
So you can download this from the RCSI mismo, from the NMBI website, and you will be able to see yan, yung scope
PDF
of
file
nursing
yan,
practice. Oo. Scope of nursing practice.
Guys, wag nyo nang i-print, guys, ha? So, I suggest, katulad nung ginawa
PDF
ko
siya.
nung nagbasa ako nito, you can actually just write, say, if principle number 1, respect for dignity of a person, lalagyan nyo lang bullet form yung mga included doon na mga topics para hindi nyo na kailangang i-print.
Ayan.
Kasi guys, bibigyan naman kayo niyan pagdating.
Ito, maganda tong Ayan. So, the core, the standards of conduct.
Palakihan ko yung ayan.
Nakikita nila, diba?
Kita nyo guys, principle 1, 2, 3. Ayan, yan yung mga values and standards of conduct. Para naman may guys, hindi lang ito para sa exam, adaptation, para din ito sa future, future jobs nyo, kasi hindi lang naman ito applicable sa hospital. Applicable din ito when you go to the community, when you become a private a
Yes.
nurse
Oo.
here. This holds your, kumbaga pa para siyang sa PRC, ito yung principle or yung professional conduct ng NMBI
Kasi 'di ba
nurses.
sa Philippines meron tayong tinatawag na nursing jurisprudence, and then we have all these yeah. So parang I think this is the equivalent, pero I think meron naman kasi tayong nursing ethics. So
Oo.
here in Ireland, this is the equivalent of that. So para at least magkaroon kayo ng overview of like ano yung talaga yung principles na importante na ginagamit natin here. So 'di ba? Para marami na kayong assignment, marami kayong
Ang daming
babasahin.
ang dami na nilang assignment, Miss Golda. Sabi pala, ayan, andyan si Nurse
Shout
Harold pala
out,
sa
Nurse
baba.
Harold.
Sabi
Nandito
niya,
siya ngayon.
hello po sa lahat. Master, grabe, Master Gail. And is maganda, Golda. Wow, grabe. 2 channels niya talaga ang nanditong nagko-comment.
Grabe, merong Nurse Harold
Grabe.
react siya kasi Nurse
Nurse
Harold.
Harold lang sa kalam. Nurse Harold lang sa kalam. Ano ka ba? Ayan.
Ay,
Malakas yun si Sir Harold eh. Idol,
kaya nga.
idol. Ayan. Pag meron
So
kaming
guys,
questions regarding YouTube or like videos, editing, ayan, number 1 yan si Nurse Harold kasi nako, master na master talaga namin yan.
Oy,
By the
sabi ni
way, yan,
Rona,
shout out ko lang.
pakikurot po si Miss Gail. Kurutin ko siya pag nakita ko
Nako,
siya.
yan sila. Nako, kasi Miss Golda, meron kaming core group ng NMBI na application. Isa yan si Rona sa mga unang-una kong kukurutin talaga pagdating dito. Yung
Oy,
na-discuss mo na
by
yung
the way
topics,
guys,
tatanungin ulit.
alam nyo ba talaga, like si Gail, super, parang twice pa lang yata tayo nag-meet, no? Parang twice. Kasi nga, pandemic and everything. Oo, parang mga twice. Si Gail talaga, kami, as in like sa FNI, like moderators and admins, we really, really appreciate her effort for like doing this NMBI as assistance for all our FNI members. Lalo na yung
Ganun
mga
talaga, Miss
starting up.
Golda.
Oo.
Pag
Inspired
walang
kasi siya.
ginagawa. Hindi,
Hindi,
ganun talaga, Miss
inspired
Golda,
talaga
pag
siya.
walang ginagawa. Ayan. Anyways, ayun na nga. Thank you then, Miss Golda, because you were, you were those first people
Kalurki, sige,
naman first
kukurutin kita,
like,
Miss Golda. Miss Golda.
actually help.
Kukurutin din kita, Miss Golda ka na, Miss Golda.
Hindi, pero pag mamaya, girl na tayo.
Oh, girl. Ano ba, girl?
Ayan. Na nga, FNI was just an instrument for me to help. And also, ano ba naman din ang gagawin ko kung sakaling wala din naman ng FNI. Sino na naman ang tutulungan ko? 'Di ba? At least Brian, yourselves, and those first moderators were the one who established it. And then tayo na lang yung nagme-maintain. Ayan. And of course, marami din tayong mga tulong, especially like even Nurse Harold, and like yung kahit iba pang mga silent readers at saka yung mga tumutulong sa atin. Ayan.
Oo nga. So,
Nurse Harold,
eventually, all
19 strong nurses.
Oo. And you know what, Gail? Etong mga viewers natin, like all these 18,000 nurses na mga paparating who are listening to our reviews, imagine niyo, so 18 kayong lahat ngayon na who are listening to the series of the discussions and all. So kapag pagdating nyo dito, kapag naging RGN na din kayo, so imagine like 18 more pa. So kung isa-isa sa 18 na yan, naging networking. Isa-isa sa 18 na yan, makakatulong kayo kahit isang nurse lang din or isang kaibigan.
Oo.
Sabi na sa inyo, open-minded ba kayo?
Diba?
Diba? So imagine nyo.
So ngayon
like,
guys, open-minded ba kayo? Meron ata ididili sa atin si Miss Golda eh.
Hindi, wala ko ididil. Ididil ko dapat we have to pay it forward and like, push kindness around. Para at least, diba, kahit imagine niyo ilang nurses tayong nandito ngayon sa discussion natin. We're 22 kasi meron kayong 20 viewers tapos dalawa tayo, di ba? So, imaginein mo yon, kahit isa lang sa atin na makatulong lang tayo ng isa pang nurse. So, di ba? Katulad nga ng sabi ni Brian doon sa interview sa kanya ng di ba nagpa-interview siya nun sa PLDT or something. Like, imagine helping one nurse.
Brian, meron ka pala PLDT, ha?
Oo, in-interview siya before PLDT ba yun? Basta in-interview siya doon. Tapos, sinabi lang talaga niya, yung very striking lang na sinabi niya sa interview is that, imagine helping one nurse. Kahit isang nurse lang yan. Pero, that one nurse has a family. So, when you're helping that one nurse or one person, tinutulungan mo rin yung pamilya niya. So, di ba, kung imagine, kung tayong lahat tutulungan natin ng isa't isa, we're not just helping one person, but we're helping that person's family para, di ba, maging maunlad sila. So, especially for the nurses that have the opportunity to go abroad and work and provide for their family. So, di ba, talagang siya, malaking tulong siya, di ba?
And cultivate
diba, open-minded ba kayo?
And then alam mo yun, open-minded ba kayo? Magsisimula tayo sa cultivate kindness. Alam mo yun? Pero yun na nga, because we share the same passion. Lagi ko ito sinasabi, because we share the same passion. Kaya we are strong, and with this community, we are strong together. Kasi nga, we have the same platform, we have the same passion and goal, and palagi natin, I'd say we always look after the newbies. We look after each other. Kahit naman na yung old na mga nandito na, we always look after each other. Kasi nga, parang, yung hashtag kill the crab and hashtag talaga, help me help others. Talagang totoo talaga yun, guys. Kasi guys, kung hindi ako tinulungan ng iba, hindi rin naman I won't be able to help you again.
I-shoutout ko muna si Melody Talmosa. So sabi niya, she is going to start her clinical adaptation tomorrow. So, all the best. Good luck. Kaya mo yan. Prayers and So, kaya mo yan. Ano lang talaga, just be yourself. Present yourself well. Smile. Be very, very interested and curious with your clinical adaptation. Yan. Si Nurse Raymond, meron siyang vlog about clinical adaptation, tips on how to pass your clinical adaptation. So, ganun lang naman. Just be humble when you're doing the clinical adaptation.
Alam niyo, guys, just present. Exactly. And take the opportunity to learn. Kasi you may know it, pero there's always a room for another information to be given to you. Kasi kahit sabihin mo na alam ko na yung infection, alam ko na yung sepsis. Pero 'di ba, malay mo may meron kaming ma-share sa inyo na ibang information. Sabi nga dito ni Nurse Harold, never be afraid to ask, guys, kahit sa adaptation. Back to square one tayo. Yes, that's actually true. Oo. Kasi kahit naman sabihin natin na senior na tayo, kahit chief nurse tayo sa Philippines, it's still a different setting pagdating dito. Kasi nga, we keep ourselves grounded and be humble. Kasi nga, you will never know. You were a chief nurse back home and you have a junior staff before. And then pagdating nyo dito, it's the other way around na. Yung senior na pala siya dito. So, always a room to learn and take all the opportunity to learn even from the young.
So, totoo yan. Kasi nga, actually guys, we never stop learning. So, every day, ito talaga, until now, in my everyday hospital duty, parati ko itong sinasabi na every day is a learning experience. May mga gamot na hindi ko kilala before na ngayon ko lang nakikita, or may mga procedures na ganito pala siya gawin. So, we just have to be open to all the learnings and to all the opportunities that come along our way. Kasi nga, if you have an open mind, if you try to put your feet grounded,
natatawa ako dun sa if you are an open mind. Para mapupunta tayo sa magkakapi po tayo. Ayan.
Hindi
By the
naman.
way, Miss Golda, sabi pala ni Janice, sabi, katawa yung news score. Vital signs pala. Akala ko ano. O, diba? Akala mo may balita. Ayan. Hindi. Ano
Ay,
lang yun.
oo.
Obs
So,
lang
so
yun.
that means, 'di ba? So somehow naliwanagan ka namin ngayon kung ano yung news scoring at ano yung sepsis screening pathway, 'di ba? So, the next time that you will encounter that when you do your reviews and all, when you do your own study time, 'di ba? At least meron ka ng idea kung ano 'yon, kung ano yung mga 'yon, at kung paano siya gamitin. So,
And
ano ba
guys,
'to?
usap na lang tayo regarding medical terms. I have an upcoming, ako lang mag-isa nun guys. I have an upcoming live stream which will discuss about medical terms na ginagamit namin dito, and medical terms in the Philippines or in Saudi Arabia na ano ang incorporation, ano ang equivalent na dito. Say like vital signs, it's OBS, say
Yung
handover
mga
is
different terminologies na
endorsement
pagkakaiba-iba.
back in the
So,
Philippines. Meron akong
yes. Ayan. So, watch out for
ayan.
that,
So
guys.
don't forget again to check Nurse Harold in videos regarding adaptation. Ayan. So, Miss Golda, do you have any, hindi naman to last, ano,
Oo nga.
reminder na lang. Ano
Another
yung mga
note.
reminder
Sige,
mo
oo.
sa mga,
To all the new nurses. So,
sige,
guys, ang akin na talaga is study, study, study. And always try to remember the reason why you're doing this. And of course, try to be happy along the way as you're doing it. Kasi, di ba, kapag hindi ka masaya sa ginagawa mo, talagang hindi, ano yan mararamdaman yan ng mga tao na nagsusurround sa'yo, lalabas yan sa ginagawa mo. So if you're happy with what you're doing, if you're happy with your decision of going to Ireland, then lalabas at lalabas talaga yan. So thank you so
and if
much
you are not
for
happy, Miss Golda, why are you even here? Alam mo yun, yung parang
diba?
ganun. If you're not
Oo.
happy, find your happiness or create your own happiness. Kung nandito ka na and you're not happy, find a way to be happy. Because happiness is a choice. Wow!
Yes.
Wow! May pagganon tayo doon. Happiness is a
Oo.
choice.
Whether your happiness is being in a relationship or being single or just helping your family, kahit anong
Yung
happiness
totoo, Miss
mo.
Golda, may pinariringgan ka po?
Hindi, wala akong
Okay,
pinariringgan.
wala.
This is very
Wala.
general,
Alright.
di ba? Kasi
Sige.
happiness is very subjective. So, to
Exactly.
each his own, di ba? So, merong mga tao na masaya sa ganito. Katulad ko, masaya ako nanonood ng BTS, ng K-pop, ng whatsoever,
Oo,
ng K-drama.
naman.
That's my happiness. Kung ang happiness ng isang tao ay, let's say, kumain ng kumain or magluto, di ba? So, like, find your happiness. Find the thing that makes you happy and be good in it or be great in it. And lalo na ngayon na pandemic and everything. So, love your decision of coming to Ireland. So, yun na lang. Para at least, diba?
Ayan, guys.
Learn to love
Ayan,
your
may reminder na
decision.
naman tayo. Parang feeling ko every time na meron tayong live stream,
Oo.
we learn something from Miss Golda. Not just,
We learn
ano,
something from each other. Ganun.
of course.
Dear
And
Ate
hindi lang,
Charo.
ay grabe siya, hindi lang naman nursing na mga information, but also, lessons in life and lessons, lessons in life. Sabi ko na nga, magagawa na talaga tayo ng GG tandem eh. Ayan. Pero yun na nga, guys. We always emphasize this, that we just be humble and learn from, ngayon lang guys, biglang ganun, kahit ngayon lang. Alam nyo yun, take everything. Kung ano yung ino-offer. Kunwari may nag-offer sa inyo na, uy, i-review kita. Take it. Uy, turuan kita ng ganito. Take it. Whatever it is. Alam mo yun? But just be careful on whatever you do, because you have to look after yourself and you have to look after other people as well. Not just yourself. Say if you have other friends who comes here. Ayan. Friends who come here pala. Ayan. So I think yun na yun, guys. Grabe, 2 hours again of learning.
Oo
And
nga.
it is so much fun. I hope you
Parang
find
feeling ko
this
yung
very
discussion
informative.
talaga natin kasi 1 hour lang. Pero yung another hour, puro chika-chika.
Pero hindi, I mean, it's always part of it. Kasi naman, parang hindi naman sila nakatunga na, ako nga kanina, nung may sinasabi kang ano, sabi ko, shucks, bakit ganon? Lumulutang na yung utak ko. Kaya pa ba? Alam mo yun? Tayo
Oo
na
nga. So,
nga.
congratulate ko silang lahat. So, thank you so much, guys.
Congratulations for finishing. So, ayan, sabi pa ni Nurse Harold, adaptation ba sila lahat or may RCSI for NH?
Feeling ko, ano,
General naman ito, Nurse Harold.
oo.
So, yung iba nasa
Magkakahalo
adaptation,
na.
yung iba nasa RCSI. So, hopefully, we will see you guys here and thank you so much for your
Once this
patience.
pandemic is over, sana
Oo.
magkita-kita tayong lahat. Tsaka, alam mo yun. Sana talaga, sana.
Oo,
Hopefully.
para ma-showcase naman ni Miss Golda ang kanyang mga BTS na mga jumps, mga jumper, at saka mga BTS, yung mga t-shirt. Anyways, you guys, thanks for this opportunity to share our knowledge and share our experience with you. And we really hope to see you on our episode 3, 4, 5, 6. There's a lot more
And
coming.
all the rest.
So, ayan. And of
watch
course,
out for the next, for the next session.
Kailangan ko muna ibudol si Miss Golda para sa next topic niya. Okay? Thank you so much, you guys. Thank you so much. Thank you, Miss Golda. Yan lang. Bye!
So, bye, guys!